Hello everyone, Dr. Barron here with virtualheadacheспecialist.com. What if I told you you could have a migraine but have no headache at all, no pain at all, just the neurological symptoms? What would you say?
You're crazy, man. You're crazy. I like you, but you're crazy.
It's true. You can have migraine attacks that have no headache or pain with them at all.
What are you, nuts?
So I just dropped a new blog on this topic specifically. It's called Acephalgic Migraine, also known as silent migraine, also known as migraine aura without headache. I will drop the link in the feed. You can check it out there. Way more details, but I want to do a little overview here first. About 25 to 30% of patients that have migraine have aura. Aura has been discussed in prior videos, my blogs. Basically what it is, it's an electrical wave that spreads across the outside of the brain called the cortex at about 2 to 3 millimeters per minute. Depending on where that electrical wave spreads, dictates the type of aura that you may experience. So there are 6 aura types. The most common by far is visual aura. This is where people get zigzags, blind spots, prisms, shapes, wavy lines, shimmering sea that people describe, scintillating scotomas, we call them. There's a lot of descriptions, kaleidoscope vision. So by far, visual aura is the most common aura. The second most common aura is sensory aura. So this can be numbness or tingling on one side of the body, usually face and arm predominantly, sometimes around the mouth. You get this also, this tingling sensation that some people get. The third most common aura is speech or language aura. This can be trouble getting your words out, slurred speech. It can be trouble comprehending language. The next 3 aura are much less common. The first is motor aura. The old term for this used to be called hemiplegic migraine. And basically it's when people can have weakness on one side of the body. The next is brainstem aura. The old term for this was basilar migraine or basilar artery migraine. And to have this, you have to have 2 of the following 7 symptoms. Either dysarthria, which is slurred speech, vertigo, tinnitus, which is ringing in the ear, hypoacusis, which is decreased hearing, diplopia, which is double vision, ataxia, which is when you're unsteady walking, or decreased level of consciousness. The 6th aura is retinal aura. So this is aura that happens only in the eye, the back of the eye, and it is one eye only. So if you close each eye individually, you see the aura only in one eye. So the duration of aura should be 5 to 60 minutes. It should not go longer than that. The exception is that motor aura or hemiplegic migraine by criteria can actually last up to 3 days. Testing for acephalgic migraine or silent migraine always should include a brain scan, preferably brain MRI with an MRA. I personally like to do EEG just to make sure there's no evidence for seizure activity somewhere in the brain. I like to also do a hypercoagulable panel to make sure the person doesn't have a tendency to form blood clots. And this is along with routine blood work as well. If the aura is visual aura without headache or retinal aura, a ophthalmologic examination is mandatory. You need to make sure there's no evidence for stroke to the back of the eye or impaired blood flow to the back of the eye. Treatment of acephalgic migraine really depends on how frequent the aura is and how disruptive it is into your life and your function. Unfortunately, there are no good abortive or acute treatments for aura symptoms, but if it's frequent enough, there are a number of preventive therapies that we use to prevent it from happening and hopefully make it less severe if it does happen. The blog will go through all of those options. So check out the blog. It'll go through way more detail. It'll answer all your questions there. If you still have questions, drop them in the feed. I'll leave the link in the feed. And if you have found anything that's been really helpful for your symptoms, drop them in the comments.